We now have some special visitors here that want to address council. In regards to Dr. Sally Wilson and Leanne Fulford are going to talk about assisted suicide or applied suicide intervention skills. And well, in addition to that, we have two other members of our Board of Health. Dr. Bill Coyne is here, and Nurse Diane Scott is here. So we welcome you on behalf of our volunteer Board of Health, and I'll turn the meeting over to Dr. Wilson and Ms. Fulford.
All
welcome.
Right. Well, thank you very much for having us tonight. We really thank City Council and also thank our City Manager, Norbert Klopsch, who's been very supportive of the Board of Health's interest in these topics and bringing them to the forefront here. So, first of all, who are we? Well, this is Leanne Fulford, who many of you probably know because she's involved in many things around the community. I'm Sally Wilson Luther. I go by Dr. Sally Wilson when I was working, and actually Luther's my married name. So we are both long-term Oakwood residents. Both of us have lived here for over 30 years. Our children grew up in the Oakwood schools and graduated from Oakwood High School. We are also survivors of suicide loss. Leanne and I both have lost sisters to suicide. My sister I lost in 2000 and Leanne's sister in 2005. And since that time, we've formed a strong bond because of that, and we've tried to work to see what we can do to decrease the rate of suicide in our area. We often say we're members of a club we didn't ask to join. So we also are volunteers for American Foundation for Suicide Prevention, and I'm a volunteer board member for the Ohio chapter of AFSP. And then I'm on the Oakwood Board of Health for the last 4 years. We're members of Montgomery County Suicide Prevention Coalition. And in 2014, Leanne and I started the Dayton Out of the Darkness Walk. And that is AFSP's primary fundraiser across the country. And we've raised, we raised over $80,000 last year and had over 2,000 walkers there last year. So it's quite an event. If you haven't been to it, I would encourage you to go. We're also certified assist trainers, and that stands for Applied Suicide Intervention Skills Training. Leanne's going to talk a little bit more about that. And then we also present other programs in the area.
It's important to realize that suicide doesn't discriminate. It affects everyone. But veterans is 22 veterans per day are lost to suicide, and with youth, it's the second leading cause of death in ages 10 to 34. And more youth die from suicide than from cancer, heart disease, AIDS, birth defects, stroke, pneumonia, the flu, and chronic lung disease combined. So a lot of people don't realize that. Like I said, it could be anyone, and I've just listed a few categories here, but anyone can die by suicide. And it's often a rash act, and if the person had a chance to think about it or just gave himself or herself time, they would probably still be alive. Okay.
All right, so we just wanted to show you a little bit about some of the statistics about suicide. So in 2018, over 48,000 Americans died by suicide. These are the most current statistics. The CDC, it's usually a 2-year lag period between the time that they get their data out. So these are the most current things. And as you can see, over almost 1.5 million people attempted suicide. And these numbers are really kind of grossly underreported, which I'll go into in a little bit here. But they feel like each suicide leaves behind an average of 115 people who are affected by the loss. So these could be family, friends, co-workers, neighbors. They could be people at your church or your synagogue. So it really affects many, many people. Youth suicide rates increased 56% from the years 2007 to 2016. And as I mentioned, these rates are underreported, and many suicides are sometimes recorded as accidents, so they aren't classified as suicide. So sometimes the data is skewed. And I've also read some recent reports that they feel like maybe 30% of the opioid overdoses are actually suicides. So it's really hard sometimes to get accurate reporting on that. Experts believe that 4 out of 10 suicides could be prevented by reducing access to means. So research shows that there can be a vulnerable time when a person may be feeling suicidal, and if you can get them through that time period, they may not go on to die by suicide. So the important thing is to try to put time and distance between a person and lethal means that may take their life. So American Foundation for Suicide Prevention, their mission is to save lives and bring hope to those affected by suicide. They were founded over 30 years ago in New York City, and they're a nonprofit. One of the main ways that they're working on now is called Project 2025, to reduce suicide 20% by the year 2025, which is a really bold goal because suicide rates have increased about 30% over the last 20 years. They have 4 different arms of this Project 2025. One has to do with firearm safety, and they're partnering with the National Shooting Sports Foundation regarding firearm safety. And this is so important because 50% of suicides are by firearm, and they're lethal 90% of the time. One of their other main initiatives is partnering with primary care practices through a program called SafeSide, where volunteers will go in and help set up this presentation where they will train the doctor, nurse, medical assistants, and people in primary care offices, and also the emergency department. They have some programs. And both of those things are really important because they feel like 30% of people have visited either their primary care doctor or an emergency department in the year before they die by suicide. So a lot of these people are getting into the medical system, but sometimes they're falling through the cracks, and we need to find out better ways to save them. And then the 4th thing is correctional facilities, because the suicide is the leading cause of death in jails. And we just had a case this last week in Dayton too, so it definitely hits home here. They are the largest private funder of suicide prevention research, and they spread this awareness with over 400 walks across the country. Then they have educational programs that help explain risk factors and focus on prevention, and advocate for mental health care on the local and national level.
The other thing Sally and I have gotten involved with is ASSIST, and it's the Applied Suicide Intervention Skills Training. It's a 2-day workshop that teaches people how to support people who are actively thinking about suicide. And a lot of times we call those people persons with thoughts, and we're we'll talk about language in a minute, but instead of saying a person at risk, we try to use positive, I don't know if positive is the right word, but the language that would help reduce the stigma. So we say person with thoughts. What this program does is it teaches people, like anyone in this room, if you're over 16, how to keep a person with thoughts safe for now. Because as Sally said, if you can keep them safe in that moment when they're in a crisis mode, it typically, if they can have just a little bit of time, then they get out, they can see how to come out. And this is what we try to help people do. So it explores all the attitudes about suicide. A lot of times an intervention can be affected because of a person's personal beliefs or attitudes, and we try to explain that to people in this workshop and show how we're not trying to change anyone's beliefs, we're trying to get them to understand how their attitudes could be a hindrance. It also teaches how to help a person with thoughts talk, because a lot of times they haven't talked, they've been isolated and they haven't reached out to anyone. And so we try to teach people, we call them caregivers, how to hear and how to also get the person to talk and then offer that support. And the biggest thing I like about Assist, because I will say I was very nervous about when Sally was trying to encourage me to do this. I kept her at arm's length for probably too long, but I was concerned about myself because my sister's death was incredibly hard. And I thought, if I'm trying to help someone and I am not successful, I don't think I could live with that. And what this program does is it explains intervening in this assist program as a first aid, and it's similar to CPR. So when you see someone who's dying of heart attack, or who's had a heart attack, you perform CPR. You do what you can to keep them alive, and then you hand them off to the professionals. And that's exactly what this is. It helps, what you're doing is you are applying mental health first aid for someone who desperately needs it. So what are we doing locally? So what we are doing is we are bringing suicide out of the darkness, and we're encouraging people to talk about suicide. And it's important to talk about suicide because, well, like when my sister died, I had no idea my neighbor across the street's brother had died. I had no idea Sally's sister had died. But when you have someone die by suicide, these people kind of come out of the woodwork and they reach out to each other. Well, now what we're trying to do is get people, before a suicide happens, to reach out to other people. We're changing the language regarding suicide to reduce that stigma, shame, and fear. So one thing we won't say is we will not say a person committed suicide. And I'm hoping everybody in this room will remember that. We say die by suicide, because if you commit something, it sounds like, one, you've thought it out and it's something that you're planning to do. A lot of times that's not even the case. It also sounds like a crime. And in some states, unfortunately, I don't know if that's still the case. There's a lot of lawyers in here, you probably know, but suicide is a crime. And it's not. It's a mental health issue. So we're just trying to change that. We're also trying to develop a suicide-safer community by teaching people how to recognize those signs of suicide, and then how to develop the plan to keep people with thoughts alive. So when we say the signs of suicide, there are warning signs that sometimes people will give off that people don't understand are a warning sign. For example, if someone is very, very depressed, and you've always known that they've been down and depressed, and then all of a sudden they've had this amazing mood swing and they're happy, that's when you should actually worry. You shouldn't be happy that that person is happy, because a lot of times that means that person has decided how they're going to die and when they're going to die. They have a plan. It doesn't always mean that, but it could mean that. If someone's giving away all of their prized possessions, like their guitar pick collection or golf balls or something that they would never give away. What's going on? Find out and just ask. And when you ask, use the word suicide. Don't say something like, "You're not going to do something crazy, are you?" Because then that person probably would not reach out to you. You want to use language that would show that you can talk about suicide and they can talk to you, and you're not scared to use the word. Kind of like Voldemort. Do you remember in the Harry Potter books? It's like that. The more we don't say the word, the more powerful Voldemort got. It's the same with suicide. Okay, and the last is we're really trying to limit the number of members in this club we never wanted to join in the first place. Hope no one in this room ever has to go through this.
Okay, so this assist workshop that we're talking about, the Oakwood Board of Health recognizes the need for this in our community and has been very supportive about trying to promote it as well. So this is going to be May 4th and 5th at Oakwood United Methodist Church. It is $20. If you are a social worker, a nurse, a licensed clinical counselor, you can get CEU credits for this. As you can see, we have the link up there, which you could take a picture of if you want, or it will be in the on the website, so you can click on it from there. And I have some literature as well as my cards, and so if you wanted to email me, I could always email the link to you as well. We also have some 1-hour programs that we are happy to do, and these are all free. So one of them is Talk Saves Lives, which is about an hour. It's a PowerPoint. We can go, it's good for general population to just give them an overview of some of the things we've talked about, but then a little bit more in depth about things. It's Real and More Than Sad are both films, and Leanne and I have both presented these to Oakwood, as well as Yellow Springs High School and Middle School, and then at University of Dayton and at Sinclair. All right, so here is our contact information. If anybody wants that, we are readily available by email.
All right. And the last thought that we thought we would like to share is that it's nice to see this, first of all. This was in the paper Sunday, suicide rate climbs and DeWine calls for action. And part of it is part of his gun initiative. Again, it's not so much about gun control as it is gun safety, that AFSP, we don't like to get into the gun debate, but it is important if you have a gun to keep it locked if you have someone who has thoughts. But one last thought is 5,200 kids died last year by suicide. Okay, so that's 5,200. Less than 150 students have died in school shootings since 2001. Okay, so in our schools, I've been present for some of those drills. They're scary. The active shooter drills, we have all kinds of things to keep kids safe, right, from active shooters. But what is the real threat? Is the real threat an active shooter, or is their own hand? So 5,200 youth, and that doesn't mean they were all students. It's the ages of 10 to 34. But still, 5,200 youth died. So we must address this national health crisis. It's not something we can ignore, and we cannot say, oh, it's just going to go away, or they're having a bad day, it's going to get better. It's important that we talk to people and use the appropriate language and explain to them it's important to talk. So this is the Suicide Prevention Lifeline. Oh, and I also wanted to say, I meant to give these out earlier, we have these resources that we have come up with that we give out at Assist. I'll just pass them around here, and then if you have any extras, you can leave them with Lori. We have given this presentation, the Assist presentation, to local communities, but after we gave it at Kettering, we gave it to the first responders at Wright-Patterson Air Force Base, and they gave us suggestions. On the back, you'll see there's some apps. So for all those kids out here and the people who love their phones, there's apps that will help you with anxiety, depression. They're free for anyone. They were developed by veterans, but they're very good. So, and I think you're going to be able to put that on a website or something and share that PDF.
All right. Thank you all very much.
Yeah, thank you.
Thank you.
Anybody on council have any questions? All right, well, thank you very much for that informative report. Okay, all right, and I guess Chief Hill wants to say a few words to us at this point. Welcome. It's a nice-looking suit you have. That's better than your uniform.
Our regular.
Yeah.
Just real quickly, this, for us in this assist training, this came about as a result of the December 2019 incident over at the school. I think although that was a positive outcome for the individual involved in that, it also facilitated discussion on a more important issue is when we get involved, and actually we from law enforcement, public safety, EMS, when we get involved with somebody who's having these thoughts, what resources do we have? What training do we have in dealing with individuals that are obviously reaching out for help? Because a lot of the times when we respond to calls for service like this and someone is having these thoughts, For us, it's pretty quickly, we evaluate it and say this person needs to go to the hospital for an emergency committal to be evaluated, and there's not much dialogue prior to that. And then shortly after the first of the year, myself, Mr. Klops, Dr. Wilson, and Leanne met, and we first heard about this assist training. And we thought it would be a great opportunity for us at the Public Safety Department to participate in such training, especially even though that some of our members could be responding to a person's house and transporting that person to the hospital. There's another half of us that are remaining at the residence, and they're dealing with the caregivers and the other people that live in the residence. So hopefully some of the resources and tools that we can take away from this training, hopefully they're never needed. But you know, if we participate in a training like this and we take one thing away that helps one person on one day, it's worth every expense, time, energy, and effort that goes into it. So on May 4th and 5th, we're going to start with sending 4 public safety officers. We're going to send a member from each crew, crew 1, crew 2, and crew 3, and we're also going to send our full-time detective, and we'll evaluate from there. And hopefully, I think as time goes on, this is starting to be a pretty frequent training for them in the area. We appreciate you hosting it here locally, but after May, I could see us sending others to this course as well. So we look forward to it. Thanks again for all the work you do on this important topic.
Well, that's great that you're doing that, and like you say, if we can save one person, you've also affected another 115, I believe you said it was. So I mean, it's just a huge way to positively impact the community.
In the statistic of 5,200, children a year, that are dying this way. When we talk about the incident in December 19th, that's one child here locally that caused us to have a conversation. But when you think there's almost 9 kids a day throughout this country that are dying in a very tragic manner, I think it's definitely a worthy discussion to have, and I think it would be very beneficial for us to give us some more resources.
Very good. All right. Any other questions for the chief? All right. Thank you for your comments.
Thanks.